To start with today, we've had 378 new cases of COVID-19 diagnosed in British Columbia, bringing the total number of people with COVID-19 to 143,264. Of the new cases, 98 were people who lived in the Vancouver Coastal Health Region, 189 are people in the Fraser Health Region, 9 were people who live in the Vancouver Island Health Region, 68 people in Interior Health, and 14 people in Northern Health. We currently have 3,543 active cases across British Columbia, 286 of whom are hospitalized, 88 in critical care or ICU. And 137,929 people are recovered from their acute illness. Sadly, today we've had an additional 7 people who have died from COVID-19 in the province, bringing that total to 1,690 people. Of the 7 who passed away in the last few days, 1 was a person in their 60s, 3 were in their 70s, and 3 were people who are seniors and elders over the age of 80. As always, through this very difficult time, our condolences go to those who have lost loved ones, to their families, to their caregivers, and to their whole communities. We mourn their loss. We have no new outbreaks to report and have now 4 active outbreaks in long-term care assisted living or independent living and 2 in acute care. Earlier this week, the details of our BC Restart plan were shared with everybody, and I just wanted to provide an update today around faith services. As many people know, we've been having ongoing meetings with faith leaders and have updated the PHO order and a variance that we had been planning to have in place for a trial period of indoor faith services prior to our circuit breaker being required in March. As this has now been updated, thanks to the work of the group that we have been working with, and the updated variance has been posted today, and guidelines about how indoor faith services can be started today safely, and that includes allowance for up to 50 people at indoor faith services with detailed COVID safety plans in place. And I just want to express my gratitude to Dr. Robert Dome and the wise counsel of the faith leaders who worked with us to develop these guidelines, and I look forward to our ongoing revision and opening up of all indoor faith services in the coming steps of our Restart program. I also want to let people know that we've been working with the camps associations and our provincial health officer order about overnight camps for children and youth will be amended in the coming days to allow them to happen this summer with specific conditions, and we're working those out with the appropriate associations. So further details will be posted as soon as next week. So I think that's good news for later on, again, in the summer. I'm also incredibly pleased to report that we've reached another milestone in our immunization program, in that we've delivered over 3 million doses to British Columbians of COVID-19 vaccines. So 3,032,811 doses of all 3 of our COVID-19 vaccines have been administered in British Columbia. Of those, 156,730 are second doses. So this equates to 65.8% of adults 18 plus, or 62% of all eligible British Columbians 12 and over right now. So these are exciting times, and this is exciting news. And we know that these vaccines work. They're safe, they're highly effective, and simply put, are saving lives across British Columbia right now. As you know, our strategy for immunization has been to provide as much protection as quickly as possible to as many people as possible to try and decrease transmission in our communities and provide that important level of protection to as many people as possible quickly. This has meant that we increase the interval between dose 1 and dose 2 to as long as a maximum of 16 weeks. Because these vaccines are so effective, our focus has been to get that as I said, that level of immunity up in communities across the province, starting with those most at risk, including people in long-term care, as we know, as well as our elders, our seniors, and communities across the province. We are making great strides, and we want to keep this momentum going. We now have sufficient confirmed deliveries of vaccine in our age-based program, that's the Pfizer and Moderna vaccines, that we can move up the interval. We've started to do that as more vaccine became available in the last few weeks and moved it up to people getting their invites for second doses at about 13 weeks. And now, for most people, we'll be moving it up to about 8 weeks. Essentially, it is important to remember that the second dose is both protection for you and added protection for us as a community. But this second booster dose is important for your own individual protection. It ensures that you have maximum protection for the maximum amount of time. So we know that the booster dose builds on the antibodies and the cell response that you get from your first dose and provides more durable and longer-lasting protection. So second doses are incredibly important for all of us, and we need to make sure that those who are most at risk get this added protection as soon as possible. Our second dose program is based on the same principles as the dose 1. Those at greatest risk will be at the top of the list for dose 2. That means our seniors and elders, Indigenous people, and people we've identified as clinically extremely vulnerable. We know that age is the biggest determinant for risk of serious illness and death, and we see that even with a high degree of immunization in people with a first dose. That's why, from our start of our program, we have taken this age-based approach for the main part of our immunization program, and that will continue with dose 2. Now that we have a steady supply coming to BC, the number of people who now have their first dose is high enough that we're able to speed up delivery of second doses for the age-based and CEV immunizations. So the standard, as I mentioned, has been as a maximum of 16 weeks. We're now moving that up to 8 weeks for the age-based and for our clinically extremely vulnerable streams. So about 400,000 people over the age of 70 and clinically extremely vulnerable will start receiving their invites today. And it took some time for us to reprogram our system to be able to do that automatically. It started this morning, as of about 7 o'clock this morning. We've started putting out the invites to those people who are over age 70 and people who are clinically extremely vulnerable. And this is how things will work going forward. Early this year, as you know, we had a panel of experts led by Dr. Maureen O'Donnell at the PHSA, who identified the clinical conditions for whom it was important that people got protection early. And those are the same people who will be in line first to get the second dose of vaccine. These people received a letter from me, and they're registered in our system, and they started to receive immunizations that coincided for the same age group of 75 to 79. Because of the limited supply we had, though, back in March and into early April, we had to phase in people with clinically extremely vulnerable conditions. And so people didn't receive the letters and their immunizations, and it was stretched out over a period of about 6 weeks. Now, with the vaccine supply that we have, everyone who is in that category will be notified at once and will be eligible starting today. So you will be able to book those appointments. Some of them will even be as soon as today and tomorrow. However, it does take some time, but people can expect to receive that invitation between now and the weekend. And everybody identified will receive an invite to book within the next few days. You're essentially first in line, along with those people in our province who are most at risk, and that is our elders. In addition, to providing moving ahead our age-based clinics in our community and mass clinics. We've also been going back and providing second doses to people in long-term care and residents and healthcare workers in long-term care. That second dose is underway, that program, and we expect to have all of long-term care and assisted living completed within the next few days to weeks. In addition, for First Nations communities and other more remote and rural communities where we did a whole-of-community approach, we will continue to take this approach for second doses, and we're working with the First Nations Health Authority and with the regional health authorities, and those are starting to happen as well. There are some communities where we've gone in for second doses already, and more will be coming in the coming weeks. There's no need, if you're in one of these communities, for communities to reach out. We will be coming to you, and we're coordinating that with the First Nations Health Authority and the regional health authorities. I do want to say, though, that we have had, over the last number of months, some challenges with receipt of supplies of Moderna vaccine. And I know that is a concern for many people, in that many of our remote communities and early on, people did receive Moderna because it's much easier logistically to travel to those, for Moderna to be taken to some of the more rural and remote communities. We are prioritizing the supplies of Moderna that we have right now to be able to make sure that when we do communities who receive Moderna for their first dose, they can receive it for their second dose. But recently, the National Advisory Committee on Immunization has reviewed again the evidence around interchangeability of vaccines, and they've updated the guidance, confirming that while it is always preferable to have the same product for the first and second doses, in some cases that isn't possible. There are a number of reasons for this. People can have an adverse reaction to a dose, or they simply don't know, or that vaccine may not be available. If that is the case, we now have good evidence that it's safe to have an alternative with the same type of vaccine. So in this case, we're talking about the messenger RNA vaccines, and we have Pfizer and Moderna are both the same type of mRNA vaccines. So it is safe, and it does work if you had a Moderna vaccine first, that you can receive a Pfizer vaccine for your second dose. This is the approach that we will be taking. As much as possible, we are going to try and make sure everybody gets the second dose with the same product they had for their first dose. But we know that some issues with the shipments of Moderna might mean that people who received Moderna in one of the mass clinics, large community clinics, may be offered Pfizer for their dose 2. And I would encourage people to take the Pfizer if it is on offer. We have just heard today that we are going to be receiving more shipments of Moderna, but we know that it is safe and works just as well if you have one or the other of the mRNA vaccines. So we're only talking about Pfizer and Moderna, and in some situations we expect it not to be common, but in some situations you may be offered a Pfizer vaccine instead of a Moderna for your dose 2. This is only an issue with Moderna, and we will try as best we can to make sure that people do get Moderna if they had that for dose 1. But if it's not always possible, in the next few weeks, we expect the supply of Moderna to level off by the end of June. So I just want people to be aware that this may happen, and that we are confident that it is safe and effective. The other complicating factor, of course, is the AstraZeneca vaccine program. For people who have received AstraZeneca, this would be through a workplace, through a pharmacy. I'm asking you to hold tight for a few more days. What we have seen is that this vaccine has a better response with a slightly longer interval between doses, and that's from the clinical trials up to 12 weeks, had a better response. So we are looking at what that means for people here in BC, and we are waiting on the results of studies that are being done, particularly in the UK, but elsewhere as well, working through as well the operational and logistical issues of how to get vaccine back to the places where people received it for their first dose. So our focus this week is on the age-based program, and I anticipate we'll have more information by the end of next week to be able to provide advice to people who've received AstraZeneca so they can make an informed decision about receiving AstraZeneca as your second dose or receiving one of the mRNA vaccines. We don't have all the information yet, but we expect to have that very soon, and we're working out the logistics with pharmacies as well. We also have, I want to assure people that we will have enough of the AstraZeneca vaccine to provide second doses for everybody who wants that. I know there has been an issue in Ontario where some people have been offered their second dose because of expiring stock that they had on hand, and I can assure you that's not an issue that we have here in BC, that our AstraZeneca that we have now that we're holding for second doses, it does not expire until the end of June. So we still have a little bit of time so people can make their best decision. So I can't overemphasize the importance right now of getting registered in our immunization registration system. It's your ticket to getting your second dose faster as well. As you know, we vaccinated a lot of people before the Get Vaccinated system was up and running, and that was about the middle of April. We weren't going to wait for the system. But for everybody who did receive their vaccine before the registration system was up and running, we do have your name, your personal health number, your mailing address, and of course, know exactly which lot of which dose of which vaccine you received. But what we don't have that's in the registration system is an email or phone number. That means if you're not registered in the system, you can't get these automated text or emails to invite you to book your dose 2 appointment. If this is the case, we are sending out letters to everybody. You will receive a letter from me letting you know that you can book your appointment for dose 2. Everyone will still be notified, and everyone will still be able to book once you are notified. It just may be a bit delayed if you're one of the people who has not yet gone on to the Get Registered system. So you do have that option right now. If you received your vaccine in one of our clinics prior to April 15th, and you have not yet gone on and registered, I encourage you to do that today, and that will just quickly give you access to the second dose as well. So what does this all mean? First, we're accelerating our dose 2 for our age-based whole of community, our age-based program, and people who are clinically extremely vulnerable. 2, second doses are underway. And like dose 1, we're gaining momentum on second doses as well. These, with the availability of supply, I anticipate that everyone will be able to have their second dose by the end of the summer. And that's important. It's important for us as we move into what we hope will be step 4 in September, where people will be protected, going back to school, going back to university, and getting back into many other things that we want to do in our lives. Our vaccines are safe and effective. They are saving lives, and this needs to be celebrated by all of us. If you've not already done so, please get registered and get vaccinated today. It's simple, it's fast, and getting vaccinated is important and integral to restarting our province and our lives. It's how we will get a handle on this virus and move out of this path of the pandemic. Join millions of us already who've received the vaccine, and let's get as many people protected as soon as we can. And let's everybody do our part in the meantime to try and stop the transmission of this virus in our communities as more and more of us are being protected. And let's, of course, remember to be kind, to be calm, and to be safe. Thank you.
Thank you very much, Dr. Henry. And I wanted to start by expressing my sorrow, my condolences to the families, the friends, the caregivers of the 7 people who passed away related to COVID-19 in the last 24 hours, 5 in the Fraser Health Authority, 2 lived in the Vancouver Coastal Health Authority. While the situation is, where some restrictions are being eased, this continues to be a difficult time for many people, and when you lose a loved one, it's always a difficult time. So I want to express as people are living through that grief, our support and our condolences and our sharing of that grief today. I wanted to note that more than 3 million vaccinations delivered is an extraordinary achievement, really, of public health in the province of a public healthcare system that has done so, giving priority to our elders, giving priority to those who are clinically vulnerable, giving priority to Indigenous communities. And this effort, which involves an enormous number of staff, of healthcare professionals, of healthcare workers, of volunteers, is a real achievement for all of us, and we want to share in that recognition today. You'll note from the numbers today, in hospital we've gone from a high in the third wave of the COVID-19 pandemic of 511 people in the hospital to 286 today, a high of 183 people in critical care to 88 today, and this is good news, and it brings with us important news about the resumption of non-urgent scheduled surgeries. So I wanted to brief all of you on that today. We have a PowerPoint presentation, and I'll take you through that, which talks about the efforts that have been made so far and the efforts that are going to be made in the coming weeks. So let's go to the first slide. Postponement of non-urgent scheduled surgeries in the Lower Mainland last month because of COVID-19. I made the same commitment, we made the same commitment to patients as I did in March 2020. You are not forgotten, and we will get each of you the surgery you need. This is an assertion based on evidence and the remarkable work of our surgical system, our public health care system, and the people who deliver surgeries. I want to take a minute to share the progress with you now, as I think it's important and reassuring as we look to resuming non-urgent scheduled surgeries in Metro Vancouver that have been postponed in the third wave. This achievement speaks to the significant progress made throughout on surgical renewal commitment. We are changing the way we deliver surgeries in BC by increasing operating room time and capacity. The result is that more patients are getting the surgery they need faster. Next slide. When we consider what we accomplished since June 2020, when all health authorities were fully operational after the first wave of COVID-19, we start to see the scope of the transformation, I think, that's occurring in BC surgeries. In this period, compared to previous years, we've completed more surgeries between June 26, 2020 and March 31st, 2021, 8,547 more surgeries, all during COVID protocols that made each surgery more challenging in order to keep people safer. We completed more scheduled surgeries. The focus of the surgical renewal plan, we completed 9,208 more scheduled surgeries. We performed the surgeries that patients needed most, holding true to our stated priorities. We completed 4,294 more urgent surgeries and 7,365 more surgeries for patients waiting more than 2 times the recommended wait time. In other words, not just focusing on reducing wait times at the beginning, but reducing the overall wait time, especially for those waiting longest. Through 74 initiatives across all health authorities, we added 21,966 hours of operating room time. We increased staff. Since April 1st, 2020, 1,459 healthcare providers have been hired to support surgical renewal. 391 surgical specialty nurses started their training, and 274 completed their programs. And 92 medical device reprocessing technology students are in training, an important part of any surgical program. Next slide. Today we're also releasing, and on the government website you can find them, our monthly reports on surgical renewal. We're releasing reports 10 and 11 today, and they bring with detailed information for all of you, information up to March 31st this year. They deal with the period from February 5th to March 31st, and they're now available. On the slide, you can see one of the key milestones achieved. We have delivered surgery to 97% of the 15,154 patients who were called during the first wave of the COVID-19 pandemic and had their surgery postponed, and who still wanted a surgical treatment. So again, to those whose surgeries have been postponed in April and May, who are just postponed, you will get your surgery. You can also see that the total wait list size has decreased to 81,940. This is a 13% decrease compared to March 31st, 2020 in a pandemic. In over just 8 weeks, from February 5th to March 31st, health authorities and care providers across this province performed 3,446 more surgeries and ran operating rooms an additional 6,667 hours. Also during this period, an additional 292 healthcare providers were hired. Next slide. I want to speak, when we launched surgical renewal in May 2020, we noted that our targets and timelines were highly vulnerable to external forces like a resurgence or future waves, and other factors over which we would have less control. We also said we would learn and adapt as we faced each new wave, and that we would manage any reduction of services differently than we did last March. And that's exactly what we've done. As the third wave brought dramatic increases in cases and hospitalizations in Metro Vancouver and started to take a toll on our hospitals and healthcare staff, on April 26, 2021, saw 9 Lower Mainland hospitals postpone non-urgent scheduled surgeries and focus only on urgent and emergent surgeries. As of May 23, 2,153 patients waiting for non-urgent scheduled surgeries had their surgery postponed. I know, that this causes tremendous anxiety. We know that every one of those surgeries is important, and we are tracking each one of them. And to these patients, I say this: you are part of our surgical renewal commitment, part of our BC Restart plan. Our surgical system is stronger than ever, and we will build on the progress we've made so far. Next slide. Last year, it took us 4 weeks to fully resume surgeries. This year, it will take us 3 weeks. All 9 sites across Metro Vancouver will be fully operational by June 7th, with actions to get us to that point starting this week. These 3 weeks leading to full resumptions of surgeries are essential. The 9 hospitals increased their ICU beds by moving into spaces traditionally used by surgical patients. These spaces and beds will now be readied for surgical patients. In addition, many staff were redeployed to support care of COVID-19 and other critically ill patients. They need time to regroup and prepare to deliver surgeries while still caring for other patients who remain in the hospital. Go to the next slide. So in Fraser Health, here's what patients and their families can count on. We have aimed to bring Burnaby back to full operations by May 25th, and we did. Between May 31st to June 4th, Royal Columbian will be back up to full surgical operations. And by Monday, June 7th, all 4 hospitals in Fraser Health, that's Burnaby and Royal Columbian, as well as Abbotsford Regional and Surrey Memorial, will be fully online and working to deliver the postponed surgeries. Next slide. In Vancouver Coastal Health, here's what patients and their families can count on. Between May 31st and June 4th, next week, St. Paul's Hospital will be back to full operations. And by Monday, June 7th, all 5 hospitals in Vancouver Coastal Health, St. Paul's, Lionsgate, Richmond, UBC, and Vancouver General will be fully online and working to deliver the postponed surgeries. In resuming non-urgent scheduled surgeries, we will apply the same principles we did in 2020. Patients needing surgeries most will have their surgery first. This includes urgent surgeries, patients who have had their surgeries postponed, patients who have waited more than twice the recommended wait time, and surgeries that do not require an overnight stay in hospital or that can be done outside the operating room. This announcement of surgical resumption is, of course, welcome and reassuring news to patients and their families, and I think to all of us. But as we consider today's news and the progress reported on the monthly reports released today, we should all know this: all those involved in delivering surgeries, the healthcare workers, those who book the surgeries, our health sciences professionals, our nurses, our doctors, all of them are the authors of these achievements. But the co-authors of these accomplishments are each of us, every one of us, for continuing to use our COVID skills and continuing to follow public health guidance and orders to stop the spread. We can't let cases surge again and impact our hospitals and surgeries. We need to get registered. Register, and we need to get vaccinated. And we need to think about what made this progress possible, and then keep doing everything we've been asked to do and are required to do, that everyone delivering surgeries is able to do the job that we're counting on them to do, and the patients get the surgeries they need. We need everyone to continue in this period where we're easing restrictions to follow public health orders and public health guidance. And we need everyone to register, all of you to register. In March 2020, we assured patients they would not be forgotten, and they were not. They weren't forgotten by me, they weren't forgotten by health authorities, they weren't forgotten by public health care, and they weren't forgotten by all of you. All of us have worked together to make sure that everyone who needs surgery in BC and who had their surgery postponed last year gets their surgery, and that we increase and reduce wait times for surgeries in our province. We need the same commitment to those patients who are affected in the third wave, and to those patients, to each of you today, I say this as well. We will be calling you again, this time, to rebook your surgery.